Hello, my name is Bill Andrews. I'm the Research Coordinator for the Human Givens Institute Practice Research Network. You may find more information about our work at www.hgiprn.org. In this short presentation, I'm going to discuss the Human Givens approach to the treatment of trauma using trauma-focused imaginal exposure. Now, if we go to NICE guidelines, reference guide about the treatment of post-traumatic stress disorder, in the guidelines we find that the treatment recommendation is for a course of trauma-focused psychological treatment, and typically this is offered over 8 to 12 sessions and sometimes requiring additional and longer sessions as well. So we're going to look at 3 different centres now within our practice research network where a lot of trauma treatment is taking place. First of all is the Sheffield Human Givens Centre. This is a chartered psychology service dealing almost exclusively with people who've been the victims of trauma of one sort or another, and typically with considerable amount of comorbidity. So a lot of the clients would be suffering from concomitant anxiety and depression problems or addiction issues or whatever. The Red Poppy Company is a service in Cornwall that works in the occupational workplace and is focused on trauma in the workplace or related to the workplace. Many clients from police services, and typically the number of sessions is 3 to 5 in treatment. The HGP group also works exclusively with trauma, frequently following road traffic crashes or industrial accidents in the workplace again. And there's often a considerable time lag since the time of the actual trauma, which of course tends to allow chronicity to set in and people's problems tend to get more generalized. Typically, the delivery of this treatment is based on an assessment followed by 4 90-minute treatment sessions. So in total 5 sessions from beginning to end. Now, the way we measure improvement, one of the ways we measure and the most useful for us for sessional measurement of change in treatment is using the core outcome measure. There are varieties of this measure that we typically use, a 34-question measure and a 10-question measure. As well as that, we also use measures that are specific to trauma. So we use a measure called the Impact of Events Extended Scale. Regardless of the measure we use, we find the information coming about the amount of improvement is largely the same. So here we're just going to look at particularly with CORE, and COREnet is the online delivery system for the measurement using these core outcome measures. Now, this is showing you the typical journey of a client in treatment. So you can see over on the left-hand side, the blue dot, the most upward left blue dot there is the beginning of treatment, and the client is scoring in the severely distressed category. And then you can see considerable improvement over time, little hiccup at the end there, but the client finishing at quite a low score in the mild to low level, which is what you'd expect for a normal, healthy population. So this gives you an idea of the journey of the client. But then we can look at the journey of clients in the aggregate. So you can see here a series of dots. Each dot represents a client, and basically it's telling you the original score of the client along the bottom axis, the x-axis, and then the y-axis is telling you the final score at the last point of measurement. When a client improves by at least 5 points, the dot ends up being green. If the client were to deteriorate, the dot is red and in the red section. You can see there's just one client down there that deteriorated somewhat in treatment. And the dots in the middle in the white section are clients who've neither improved nor deteriorated by more than 5 points. Clearly, in treatment, it's highly desirable if the most of the dots are green, first of all, and secondly, if the dots are in the green section of the chart. So you can see here in this example, most of the dots are in the green section of the chart, and this is indicating, in fact, that all of these clients have made very, very good progress indeed in treatment. If we go on then to look at this, this is called a scatter plot. If we look at the scatter plot for the Red Poppy Company, the service for occupational trauma in the workplace, again you can see the clusters of green dots and no sign of a red dot at all on this particular chart. and most of these green dots are in the green part of the chart, showing that considerable improvement has taken place in treatment. Once again, if we look at the HGP group, we see again large clusters of green dots, highly indicative of very effective treatment. Now, another way of looking at the service, for example in the case of HGP here, is at what's called the appraisal chart. And basically I'd just like to bring your attention to a couple of points on this chart. What this is telling us here is that 98% of the clients who started treatment were measured at the end of treatment. Now this is very, very high. Basically, in effect, pretty much everybody who started treatment was measured at the end, which means one can be highly confident about the results of the treatment. And you can see below that the 97 is the clinical and/or reliable improvement. So 97% of those clients who were measured showed significant improvement in treatment. If you look across then, it's not a direct comparison with trauma, but it is a general comparison with measurement in psychological therapies in primary care. You can see first of all that only 45% have a second point of measurement, which means one has to be far less confident in the results because obviously 55% of the clients weren't measured. And the second point is that on the average, for those 45% who were measured, the clinical and reliable improvement rates are 70%. So you can see in HGP certainly a considerable increase in benefit in treatment, looking at actually a far more distressed group of clients, because trauma wouldn't typically be treated in primary care in the first place. Now, the actual treatment itself, well, it has a different emphasis from the more traditional trauma-focused treatments. But yet at the same time it shares all of the common elements of these treatments, in the sense that the focus of the treatment is actually on the material of the trauma itself. It's recalled in the memory process and it is processed accordingly. But it is a far less invasive approach. It's far less stressful for the client because they don't have to actually voice their memories about the particular trauma at all. And it's non-voyeuristic. In fact, the therapist doesn't even have to know what the content of the trauma was. This can be very, very significant for material that's of a very, very private or has been of a very invasive nature or very, very stressful indeed. And the other thing about it is that the clients are kept relatively calm throughout the whole process, which is quite unusual in trauma-focused treatment. And another indication of the fact is that it's very widely accepted by clients because there tends to be a low dropout rate. This is not at all typical of traditional cognitive behavioral therapy techniques that involve the imaginal exposure regurgitation of the trauma through verbalization. There we often find a very high dropout rate because clients just find it very, very difficult and very stressful to actually articulate about the trauma in this way. So this is a very, very nice way of working with trauma, which keeps the client relatively calm. It's much more manageable from the therapist's point of view, and it seems to be a very highly acceptable technique. So I hope this short presentation gives you some indication of the benefits that appear to be there coming up within our practice research network for the treatment of trauma using this trauma-focused imaginal exposure technique that is described and trained with using the Human Givens approach. Thank you for your time. If you have any further questions, you may call me on 0114 250 7228, or you can email me at wandrews22@mac.com. Thank you.